Welcome to the Heal Your Hunger Show, where we get to the heart of why you overeat and how to stop. If you struggle with food and weight like I did, welcome home.
Welcome, everybody, to the Heal Your Hunger Show. So happy to have you here. It is a great day to be alive, and I'm so excited for my guest today. She is absolutely amazing and the go-to for all kinds of issues regarding hormones, women's health, sexual function, the whole 9 yards. So I can't wait to hear what she has to say about all kinds of things I want to ask her about. So so I'm glad you're here. And guess what? If you are not part of the secret sauce to end emotional eating, you must be. This is a group in Facebook where I pop in often, and we also add all kinds of inspirational messages and support for anybody struggling with emotional eating. And if you don't know if you're an emotional eater or not, you also must take the quiz, the emotional eating quiz, to find out if you're an emotional eater or a food addict or somewhere in between. So check out the emotional eating quiz on my website, healyourhunger.com. Okay, on with the show. Okay, so my guest, Dr. Anna Cabeca, is triple board certified and a fellow of gynecology and obstetrics, integrative medicine, and anti-aging and regenerative medicine. She has special certifications in functional medicine, sexual health, and bioidentical hormone replacement therapy. She's known for her work using natural alternatives and traditional healing modalities for managing menopause successfully. She's absolutely amazing. She actually has some really cool products out for women's sexual health that I love. We're going to talk about that as well. It's called it's called Julva, after the word vulva, obviously. But she's just the coolest. She's absolutely the coolest, and I'm so excited to speak with her right now. Dr. Anna, hey girl.
It's great to be here with you, Tricia.
I'm so glad you're here. I adore you and I love your work, and you help so many women, and I just really appreciate you for that. And I'm just, as I just mentioned, I'm 56. I'm going through menopause right now. It's interesting, but not terrible, thank God. I want to make sure we talk about your, some of your products, because that I have questions. I'm pretty selfish. I like, my show's basically for me. So like, I'm here to learn things that I want to know, and if anybody else benefits, fantastic. So
Exactly.
we'll cover it all. So so thanks for being here. So first things first, what are can you tell me the difference? Well, first, let's start with your story, because you have an amazing story, and how you even got into, this line of work, so to speak. I mean, that doesn't do it justice, but you have an amazing story.
Thank you. So I was diagnosed with early menopause and infertility first in 38 and 39 years old. 38, I was struggling with early menopause post-traumatically, post the loss of my son in a tragic accident. And it threw my body from a breastfeeding mom of my young toddler to to be completely diagnosed with infertility. And my husband and I at the time really wanted to have another child. So after failing 6 rounds of the highest doses of fertility meds, and then, never recovering my period, I was diagnosed at 39 with early menopause. And that was tragic, because here I am, a, gynecologist. I run a very boutique clinic in Southeast Georgia and a med spa, and, running, burning the candle at both ends, so to speak, and helping so many people with fertility issues and pregnancy and hormonal issues and sexual health issues, all of those things. And I felt like my doctor's bag was empty. How could I be diagnosed with this? And in my grief, compounded grief, went on a journey around the world, just kind of a healing journey, looking for answers. I didn't want every day to look like nothing had changed in my life, and I think that was really important for me and my family. And I took a year sabbatical by the grace of God. Another doctor, Dr. Deborah Shepherd, came in and took over my medical practice, and we traveled. And as a result of that, and what I learned along the way, the healing modalities and the medicinal foods and herbs and roots and strategies, my early menopause completely reversed, which is really unheard of. And I naturally conceived the child I was told I would never be able to have, and I was 41 at the time. So really, like, that just blew my mind, and I'm so grateful. I said, with the grace of God, again, with the grace of God, I was able to have this child. And from that, understanding, okay, it's not in a prescription pad and a drug. Our body's health is in our mind and our own power for the most part. And so that it made me dig into the underlying reasons for the infertility and the early menopause to begin with, and then to support, my body and my patients' bodies in being empowered and regenerating, resuscitating essentially their ovaries, their hormones, their adrenal glands, to help support them in any stage of life.
That's beautiful. I love that. And honestly, I don't know if I forgot or didn't know some of those details. So that's incredible. Wow. So incredible. And makes me love you more.
Oh.
You have so much experience, and you put so much heart and soul into the work that you do. So can we talk about, I think it's really important to cover the difference between perimenopause and I'm going menopause. Okay. That's what I'm talking about because of
Yeah.
my age and where I'm at. Right. I know I've had you on before. I wasn't there yet then. So we talked about other things. So you have to keep coming back based on, where I'm at.
Waiting.
Okay.
I love it.
But can you talk about the difference between perimenopause and menopause?
Yeah, menopause is you're giving this day menopause when you're 12 months without a period. And so that is considered, now you're menopause, then you're postmenopausal. But it's not uncommon for people to be diagnosed with menopause or to go months and months without a period, and then it to restart again. And as was in my case, as in many clients that I've helped, even in their 50s. So
yeah, and to be honest, that's that would make me perimenopausal because it's only been a few months since. Yeah, I went like 6 months and a period for a few months, and now I'm a couple months out, maybe 3 months out from my last period.
Yeah, so that's perimenopause when your
Okay.
symptoms, and that can be symptoms like PMS, mood swings, difficulty sleeping, hair loss, weight gain with, out doing anything different, and heart palpitations, frozen shoulder, muscle aches. I mean, the symptoms of the hormonal loss can manifest in many different ways. And so perimenopause is considered the time leading up to menopause, but it's really poorly named because you think you think around the time of menopause. And that's probably a better way to describe it. You're in
Okay.
perimenopause, then you're postmenopausal, basically.
Got it. Okay. So my symptoms, again, it's all about me. My symptoms were pretty much only, as far as I can tell, hot flashes. So like for a year, I've been dealing with hot flashes, and I find it very fascinating because if I'm not getting a period, I will have hot flashes. And the minute I get a period, like within a change of a day, right? The minute I get the period, hot flashes are over. Except recently when I was taking some different supplements that have, I think, helped my hot flashes abate without getting my period. So that's kind of where I'm at in terms of symptoms.
Yeah, definitely. And that's easy. The hot flashes, though, that can affect women. I know I've had clients who've had hot flashes for 15 years. And so, I mean, that is probably one of the most aggravating symptoms. And it is, I have found through, nutritional supplementation, the herbs and stuff that I've used, it can help that tremendously go away. And especially in cases where people have had breast cancer and they're suffering with hot flashes and their doctor's like, I can't do anything for you, which isn't true. There's so much that we can do. I see
Yes.
Yeah, constantly working with clients that have been told that, and their hot flashes can be gone and completely in 2 weeks. So it's powerful, but it's telling you your body's out of balance, and often it's your liver that needs support and detoxification. So that's part of the supplementation routine too. And then using bioidentical hormones, especially in this transition time with the life we're living here in America with stress and chemical exposures versus if we were living in the Amazon, and out in nature or, really connected with nature for the majority of our day, probably don't need very much, if anything at all, as proven by the blue zones or the areas in the world where they're longest living people and they've never been on hormones, right? So I've yet to see someone on a tremendous amount of hormones and supplements lived past 100, but I've my biohacking friends and longevity friends are working on that. And my big thing is about, instead of hormone replacement, it's hormone replenishment. It's again supporting your body's natural ability to use the hormones you're making as well as making more of them. And then again, supplementing, replenishing when we need to. I think the biggest issue in modern day medicine is that we put suppressive levels of hormones on, whether it's testosterone or estrogen, even progesterone. If we're using hormones and we're suppressing our body's own ability to make those hormones. So we have to be very careful about that.
Okay, interesting. So, but you're a proponent of bioidentical hormones. So can we talk about that next, the difference between that and hormone replacement therapy?
Yeah. So with some hormone replacement therapy, when we're talking that, can be bioidentical. Estradiol typically, and there's like the estrogen patches, and there's bioidentical progesterone or prometrium that can be used. The synthetic ones are where we get into trouble, especially when it comes to the progestins. Those are synthetic mimickers of progesterone, but actually work very differently on our body. And progestins, the synthetic ones like Provera and Prempro and in other like norethindrones and different types of progestins have adverse cardiac benefit, increase your risk for breast cancer, can increase weight gain and hair loss, and other things that we don't want, right? We don't want those in our system. And they're in birth control pills, sadly. Progestins, different types, some worse than others, are in birth control pills. And so that's why we see these negative consequences from birth control pills, long-time birth control users.
Okay, wow, how interesting. And so can you really chunk down what bioidentical hormones are?
Yeah, so the term bioidentical and body identical, which you may hear, basically the same thing. And that is identical to what your body's producing in and of itself. So say, for example, like progesterone. So I created a progesterone cream with pregnenolone, another one. These are two of our major hormones. And of course, I added in some anti-aging skin ingredients, tripeptides in there. So, if you're going to put something on your skin, I'm like, let it have some cosmetic benefits, then we will use it more. At least I will, right? And so,
now which product is this?
That's my Balance cream. It's called Balance. Yep. And it has progesterone and pregnenolone, so transdermal. So our progesterone is body identical. Excuse me. Is body identical or bioidentical. And it's derived from wild yams, but it's not a yam cream. It's a bioidentical progesterone cream.
Interesting. And you don't need a prescription for that? Nice. How very, very interesting. So okay, with that, so the question is, would that help? Is that something somebody takes or just because they're in that right mode, or do they need certain symptoms to justify taking something like that?
With progesterone, because it starts to decrease in our mid to late 30s, we see a significant decrease in progesterone. And that often leads to the PMS symptoms, anxiety, headache, menstrual headaches, irritability. And I always tell my clients, if you only hate your husband or your partner 2 weeks out of the month, it's probably your hormones and not necessarily your partner. But it's so true. I mean, it's our a tolerability hormone, if you want to say. but it's also very neuroprotective and brain protective. So progesterone and pregnenolone, both of them are mother hormones, and progesterone specifically is majorly produced by the ovaries and partly by the adrenals. But in menopause and this transition time, the adrenals are pumping out more progesterone at more of a steady state instead of the swing with your menstrual cycle. And so, but it can decline significantly, and with that, brain fog, memory loss, mood changes, all of those are really specific to progesterone too.
Okay, interesting. And is it a daily cream?
So, perimenopause, I like you to use it with your cycle. So start 2 weeks after your period, then continue when, like, you're having a period every 3 months, continue to your next bleeding cycle.
Okay.
Or typically take 5 to 7 days off a month if you're in that irregular stage. When my clients that are cycling every month only use progesterone during their luteal phase, so from day 14 of their cycle till day 28. And then postmenopause, pretty much every day except take 1 day off a week, 1 to 2 days off a week, or 3 to 5 days off a month, just to keep from that suppression, just to keep the receptor sites open and to keep signaling your body that you got to keep making more. We don't want to suppress the neural network. So that's what I found to work best for my patients long term. And myself, I think I'll be on progesterone till I die. Use it regularly. And so many, this is something funny, Tricia. So I'll send you some progesterone, and this is how I want you to use it. So because progesterone, pregnenolone, and tripeptide that's in that is anti-aging, reduces sunspots, and helps with wrinkles and firmness of skin and stuff like that. Use it, use it on your neck and décolletage area. You can use it around your face and that area as well as the vulvar area too, clitoris to anus, just like my DHEA cream, which is Julva. And so use these, use it that way versus I had someone in my office yesterday for a consultation and she's been on hormones. I'm like, well, where are you putting it? She's like, on my inner wrist and behind my knee. I'm like, oh, such a waste. Such a waste.
Okay, interesting.
Yeah.
Okay. And why in those places though? Like how does it actually help you there?
So you want to put the creams on areas where there's thin skin. So where you
Right.
have veins, not your buttocks, not necessarily your abdomen, not your thighs. You can do it on the inner thighs where it's more vascular, but that's where the perineum, the pelvic floor, and that ages just like anything else with us. And that creates a lot of the problems, vaginal
Okay.
dryness, incontinence issues, itching, discomfort, recurrent urinary tract infections. So you want to keep that tissue healthy, and the hormones have been the best thing for that topically.
Wow, interesting. So that brings me to my next question about dryness, because it's so funny, Anna, because I've had people talk, and we've talked about hormone stuff over the years, and I'm always like, that dryness thing, I put my fingers in my ears, I'm like, la 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 la, like I don't want to know about it.
I know, it's terrible. It's terrible.
I'm so
But
scared of the power of suggestions. I'm like, ah. But now I'm like, okay, I know it's a slight difference, and so I want to make sure I don't go all the way down that rabbit hole.
yeah, exactly. Ounce of prevention's worth a pound of cure, as the saying
Yeah,
goes. And it's something we don't even like. Oftentimes, it's so subtle that we don't realize it's happening, but it happens to every vagina. I'm a gynecologist. It happens to every vagina, and we can reverse those changes. And it
okay.
doesn't have to be with expensive lasers or procedures. Those can be beneficial, but the really working, and that's why I created my Julva cream, because of the DHA and plant stem cells that I put in there to help
Okay.
with that reverse aging. And so as a woman, we look at, we're preventing, we don't want our marionette lines, as they're called, or I
Right.
like to say smile lines and laugh lines. And we're like, I can have those. Those are fine, but we want them, when I'm 100, not right now.
Right.
And, but so we take good care of our skin and our face and, hopefully our neck and our décolletage area, but it's the pelvic floor that causes the discomfort. Like
Ah,
like we love to look at ourselves and see a great smile and healthy eyes, right? that the pelvic floor, when we have that dryness starting, and it will happen to every one of us. I mean, things that makes the difference is keeping the blood flow to that pelvic floor area. So pelvic floor exercises, the squeezing, pulling up the pelvic floor muscles, contracting the muscles. I say clitoris to anus and pull it up on an exhale, like belly empty. Because if you're inhaling as you're doing it, or you have abdominal pressure, you're working pressure against pressure, and that defeats the purpose. You want to strengthen that pelvic floor, and that's the exercise we have to do till we die. Tricia, we've got to keep doing our pelvic floor
Okay,
exercises.
so wait, you lost me a little bit on the breath thing. So how do we do it?
So just take a deep breath in and just exhale completely, relax the pelvic floor. Feel those the muscles in the pelvic floor, vaginal area, urethra, just let it relax. And then as you've exhaled, make a contraction and lift those muscles up. So your pelvic floor is like this, contract. So you inhale, relax, and bring those muscles up.
Okay.
And so, yeah.
Interesting. Okay.
And try to hold it for 3 to 5 seconds and do that several times in a row.
Okay.
So,
Wow. Okay. This is great. Thank you for letting me know that. So I never thought of the dryness being affected by the pelvic floor or part of that whole thing.
yeah,
So
blood
that's
flow to
interesting.
muscles, because we lose, like anywhere else on our body, under our arms or wherever, we're losing that muscle and that elasticity of the tissue. It's happening there too. And it's a very vascular area because it's designed that way so it can expand, so we can deliver a baby through there. But then as we
Right.
age, it gets narrower, narrower, and thinner, and gradually it can cause that that decrease in the healthy vaginal pH, which is more acidic to prevent bacteria. It's a barrier. So the
Okay.
vagina is very acidic, but as we age, it becomes more alkaline. And so bacterial vaginosis infections, or that fishy odor, those, gray discharge, all of those things can result from that tissue just not being healthy. And your doctor may just say, oh, you have atrophic vaginitis or, recurrent bacterial vaginitis, because the pH of the vagina isn't healthy. And so it's just so aggravating, because so many women are left untreated for so long until the symptoms are so severe. So urinary tract infections, because the same thing around the urethral sphincter, it's to prevent bacteria from coming into the bladder that start to experience bladder infections. And that can be reversed by keeping that tissue healthy. And that makes the difference too. Yeah. And that's the thing, like you
Okay.
have sex and then you have discomfort, odor, irritation, and it's
Oh,
just painful. And you're like, that's not the reason. Then you slowly don't want to have more sex. And it's so
yes.
subconscious. You become, instead of lovers, you're now roommates. And you don't realize that may be part of the issue there. And then we want to have, good sex with a partner that we love, and because that increases oxytocin and keeps you connected. So
Yes.
vaginal health, to me, as a gynecologist, of course, is critically important. And also because you don't want it to go too long where it becomes more problems like prolapses and, incontinence, and
Right.
it's not good.
So will you talk to us about Julva and how that helps with all this?
Yeah. So Jolva, my cream here, it's made with, first I used to compound all my patients, all their creams. And then
Wow.
when I had closed my practice back in Georgia, my patients were like, Dr. Anna, no one will give us your creams. Like, they're not familiar with these concoctions. So I committed to my patients. I said, I'm going to create something that is better than anything I could write on a prescription pad, and you don't need a prescription for. So Jolva was the first. I created it in 2015, released it in 2016. It took me years in the formulation, but released it in 2016, and it is the first vulvar cosmetic cream. So it's a cosmetic cream for the vulva. Again, more important in my opinion than the smile lines and laugh lines on our face. But it is designed with DHEA and plant stem cells from the alpine rose, which I found to be really beautiful. The alpine rose, Tricia, when I was looking at stem cells, because I used peptides in balance, and I wanted to use stem cells for their anti-aging and rejuvenation powers. And when I came across the alpine rose stem cells and the research behind it, first I was like looking at this beautiful rose that grows in the Swiss Alps amidst the harsh conditions of rocky terrain and ice and snow and extreme weathers. And I was like, oh my gosh, that is the epitome of femininity as we age, right? The
Yeah.
blossoming rose, despite all the challenges, et cetera, that we face or have faced in our life. And then the plant stem cells of the alpine rose are help to produce collagen, so decreasing fine lines and wrinkles. They're antiviral, which is, again, we want things to keep, viruses away, like HSV, herpes virus, or other viruses from our body. And so the benefit is really good. And then I put in coconut oil, emu oil, and shea butter. And what I worked on clinically was so the vagina is rejuvenated, that it helps your body produce its own natural moisture. It can be used as a lubricant, definitely great to use during sex and safe for your male partner compared to estrogen, which many people get vaginal estrogen cream, but you don't want your mate, our male partner, to get extra estrogen. They don't need it. But
Right.
with the combination here, this is perfectly safe for men as well.
Nice. Wow. That's amazing. And then
Yeah.
so it's not necessarily for sex. So you do put it like on daily? You just,
You put it on daily.
okay.
Daily preventative. I have a client who's 65, and she boasts that she has the vagina of her 25-year-old. So, and I hear that many times. Like gynecologists will reach out to me and say, Dr. Anna, your patient was in here and she's been using Jolva. I mean, she's just like the transformation has been incredible, and it's recommended by doctors' offices all over the country and in the world. So if your doctor hasn't heard of it, we got to get them some. But it does
Wow.
it does make a difference. It's natural. It's clean ingredients. There's no parabens. There's no sulfates. There's no toxins, no hormone disruptors. It was really important to me to create something very clean because the vulva vaginal area is very vascular. And so it absorbs toxins from our pads, from the laundry detergent we've used on our clothes, from other chemicals and feminine washes or soaps. And that's a route to toxins, and that creates more tissue damage. So we want to be very conscious of those things that we can eliminate too that are worsening the problem.
Oh my gosh, I love that you created this. This is so cool. And I want to put a link here where people can get that. So we're gonna put that in the show notes. I think that would be amazing. Any other products we haven't talked about?
Well, my groundbreaking one that I created way back from my journey around the world was putting all the superfoods that I learned about and started using, I think was key to helping my body. I put those into this Mighty Maca Plus superfood formula that this is what my breast cancer patients drink. This is one of the foundational supplements that I recommend for pretty much all of my clients. And it helps with improving your body. It helps support detox. So there's 30 superfoods plus organic Peruvian maca in this. And it helps to restore your DHEA, helps support your DHEA and natural progesterone levels, helps detox your liver. So the combination of superfoods are pretty powerful in that. So with the hot flashes, that's like the secret to getting rid of hot flashes.
Wow, super cool. I remember when you came out with these products. It's so cool. I mean, I think your Maca Magic or Magic Maca was first, right?
Mighty Maca was first.
Mighty Maca.
Yeah, Mighty
Wow.
Maca.
Good for you. Oh my gosh. Thank you so much for putting all the blood, sweat, and tears that it goes into creating
I'm
a
telling you, I
product.
wouldn't be here without it for sure. I
Yeah.
mean, I remember there was, I've been to hell and back, and so I don't want
Yes.
anyone to suffer like I've suffered. And I saw my mom suffer at a time when I wasn't able to help her. So I
Wow.
learned so much to just really empower the female body and the male body. But, my focus is on the female body, but really work to empower us so that we're relying on our own natural resources versus the prescriptions and surgeries as much as possible, avoiding them. And I say that, Tricia, because especially when it comes to bladder surgery, I used to do a lot of bladder sling procedures for incontinence, to stitch up the urethra so that it's tighter and you don't leak when you cough and sneeze as much. So a lot of surgical procedures and hysterectomies and endometrial ablations. But as I got good, and I would say I would do 2 to 3 surgeries a week, major and minor. But as I got good with the way that help your body feel empowered, so with detoxification, with nutritional guidance, with supporting the liver, with Mighty Maca and using progesterone when necessary. I mean, I went from doing 2 to 3 surgeries per week to needing to do 2 to 3 major surgeries per year. That's the difference.
Wow. Wow, that's amazing.
The
Well, thank
body's
you for,
amazing.
yeah, the body is amazing and it needs help, right? It needs help. It needs assistance as we go through these phases of life. So I really love that you figured these things out. It's really, I mean, to be honest, somebody close to me told me that it just like sex just hurts her. Like it just hurts to have sex. And I'm just like, that is not right. That is
Not right.
just not right. That is not right.
Yeah,
So,
not right. So
no.
definitely, Jova, figure out what's going on with a guy. But often they've seen the gynecologist, they've had ultrasound, and if you have pain and you haven't done that, you need to do that. We got to
Yeah.
figure out what's going on. And then, but often it's just that reversing the tissue damage that's occurred.
Yeah, absolutely. Well,
Mm.
thank you again for sharing about that and doing all the work to create that product because it's really important that it is natural and not harming in some way with ingredients that our bodies aren't amenable to.
Yeah.
Okay, well, this has been awesome as usual. Thank you so much. You do have, I mean, we didn't even get into the book, but will you talk about your latest book as well? Because people need to know about it.
Yeah, so my latest book is Menu Pause. So it's 5 different 6-day menu plans that each pause something to help, but all of them are medicinal foods that we use to help balance our hormones and detox and support your body naturally. So following along the principles of my keto green or keto alkaline guidelines between food and environment and lifestyle that we put together. And so this book incorporated my love for travel around the world, incorporating foods and recipes and pearls that women have used from around the world to help support their menopause naturally. So I incorporated that piece into the book too, but the menu plans are really easy to follow. And I usually say start with the Keto Green Extreme menu plan. But my book, The Hormone Fix, that's one I give to all my patients because yes, it
Love
is my
it.
magnus opus. It is really, really good. And
It is good.
yeah.
Yeah, awesome. Well, thanks for sharing all that. As you can tell, Dr. Anna is an amazing resource for all things women's health, and you must get her books. You just must get her books, and just know she's the trusted resource for all these different kinds of information about our bodies, but also the menus. I mean, how cool is that? Like that we can eat in a way that supports our bodies. Obviously not emotionally eating, not binge eating, not eating crappy foods and sugar and that kind of thing. But beyond that, eating foods that literally can heal our body. So I love it. So I have one last question for you, Dr. Anna. First of all, thank you for being here. Appreciate you, girl. This being the Heal Your Hunger show, what would you say is your deepest hunger at this time?
Oh, my deepest hunger is actually for Middle Eastern peace. It's
Oh,
just for Middle
amen.
Eastern peace in Palestine and in Israel. It's just like my
Mm,
heart is breaking for
absolutely.
what is happening now. So that is my prayer every day. That is, the impetus behind me showing up with love and continuing to give and to share. But
It
uh,
makes a difference, right?
mhm.
Every bit of love we put in the world is helping the consciousness of the world. So I love that. So thank you for
Thank
sharing
you.
that and amen to that. So thanks for being on the show. We just adore you. Friends, you can go to the show notes and get some links to get the products that you're hearing about because they're awesome. So thank you so much, everybody. Love you so much. Dr. Anna, you're the best.
Thank you for having me, Tricia. Thanks, everyone.
If you enjoyed this podcast and want to get free support, insider health info, exclusive invites to events, and more, visit healyourhunger.com.